Hello, Assalamu alaikum. I am Dr. Firoz. Welcome you all from Mediscope MRCS. Today's topic is brachial plexus, its anatomy, and what are the injuries that can be happened in brachial plexus. So let's start. At first, I want to say that how brachial plexus is formed. Brachial plexus is formed from five nerve root that are C5, C6, 7, 8 and T1. And these roots, mainly C5 and C6 together unite to form the upper trunk. So the mode of formation is root, trunks, divisions and cords. So C5 and C6 roots unite to form upper trunk. C7 root is alone form the middle trunk. And lastly C8 and T1, these two nerve root unite to form lower trunk. Then we have three trunks, upper, middle and lower. Each of the trunk is further divided into two divisions, one anterior division and one posterior division. So three trunks divided into in total of six division, three anterior division and three posterior division. Then all the posterior division, all three posterior division unites to form the posterior trunk. Okay, and the anterior division of upper and middle trunk unite to form the lateral cord, and lastly the remaining anterior division of lower trunk alone form the medial cord. Here there may be a question asked the position of the roots, trunks, divisions and cords. Roots of the brachial plexus are located between two muscles. One is scalenus anterior and scalenus medius. In between two muscles, these roots lies. Then, what are the sides of trunks of the brachial plexus? Trunks lies at the base of the posterior triangle of the neck. Then division lies just behind the middle 1/3 of the clavicle. And last one, cords. There is a question why the cord, lateral cord is called lateral, posterior is called posterior. It is termed as because they are related to axillary artery, and based upon these relation these cords are termed accordingly, such as posterior cord lies posterior to the axillary artery, lateral cord lies lateral, and medial cord lies medial to the axillary artery. Okay, then what are the branches arise from the brachial plexus? At first, I will start from the root. From the root, there are three nerves arise from the roots. At first, from C5, C6 and C7. From these three roots, there arise long thoracic nerve or nerve to the serratus anterior. So, the long thoracic nerve root value will be C5, C6 and C7. Not all the root values of brachial plexus is important, some are important. The important The important root value that should be memorized or that should be learned, I will tell you. So at first, long thoracic nerve root value is C5, C6 and C7. Second nerve arise from the root is dorsal scapular nerve arise from the C5 root. Dorsal scapular nerve is also called nerve to the rhomboid. And from the C5 there is a minor contribution to the phrenic nerve, as because the root value of phrenic nerve is C3, 4 and 5. So a minor contribution is given by C5. So from the root there is three nerve: long thoracic nerve, dorsal scapular nerve and part of phrenic nerve. Okay. Then what are the branches arise from the trunk? There are two nerves arise from the upper trunk only. Middle and lower trunk do not give any branches. So what are the branches of the upper trunks? One is suprascapular nerve. The root value will be C5 and C6, and another is nerve to subclavius. So these branches are important as because these branches are related to Erb's palsy. So two nerves arise from the trunks. Okay. Then a division. No branches arise from the division, but the main branches arise from the cords. Okay, let's see what are the branches from the different cords. From the lateral cord, there is three nerve originated. One is lateral pectoral nerve. So medial pectoral nerve will be arise from the medial cord. Okay. Then second nerve arise from the lateral cord is musculocutaneous nerve. The root value of musculocutaneous nerve is also C5, 6 and 7. And the third nerve arise from the lateral cord is the lateral root of median nerve. So medial root of median nerve will be arise from the medial cord. Okay. Then come to the medial cord. We previously told that medial pectoral nerve is originated from the medial cord and medial root of median nerve. Besides, there are another three nerves that get origin from the medial cord, that is medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm and and ulnar nerve. Last one is ulnar nerve. So these are the nerves originated from medial cord. And lastly, from the posterior cord there are five nerves. You can memorize by a mnemonic, that is ulnar, ULNAR. U means upper subscapular nerve, L means lower subscapular nerve, N means nerve to the latissimus dorsi, that means thoracodorsal nerve. Okay. A means axillary nerve, R means radial nerve. Here root value of radial nerve and median nerves are same. Both these nerves get their contribution from all five nerve roots. So the root value of radial nerve and median nerve will be C5, 6, 7, 8 and T1. Okay, next slide. Here is an illustration of brachial plexus. You can see that roots are lies between the two muscle, scalenus anterior and medius. Trunks are located at the base of the posterior triangle, and here is the division just behind the middle one third of the clavicle, and cords are related to the axillary artery. Okay, I told all of this just to summarize this. Oh, here is the important question comes previously, that C5 nerve root, relation between C5 nerve root and C5 vertebra. So you have to know that the C5 nerve root emerges below the C5 vertebra. You can see the picture. Not really given here. Okay. So these are the branches of brachial plexus from roots, from trunks, and no branches from the division. Here is the branches of cord. Branches of posterior cords can be mnemonic by ulnar. Okay. Here the last root value of ulnar nerve is C7, C8 and T1. Okay, then the important topics is what is Arps paralysis. In brachial plexus there is a point names Arps points. Here 6 nerve meets at the point. This point is called Arps point. So one is root from C5 nerve root, second is C6 nerve root, and this forms the upper trunk. And then upper trunks divided into anterior and posterior division. So we got 4 nerves, C5, C6, anterior division and posterior division. And the last 2 nerves at the arc points are arising from the upper trunk. We know that one is supraescapular nerve and another is nerve to subclavius. So this is the Arps points, and in Arps paralysis mainly injury occurs at this point. So we have to know that in case of Arps paralysis mainly C5 and C6 nerve roots are involved. So those nerves that contain C5 and C6 will be mainly affected, and the muscles supplied by these nerves also will be affected. So let's see what are the nerves affected. In case of Arps palsy, the site of injury will be upper trunk, that means the Arps points. How the Arps palsy occurs? There is some mechanism proposed, or classical mechanism, that include undue separation of the head of the humerus from the glenoid cavity. That could happen in case of birth injury or difficult childbirth. The term is also called shoulder dystocia. Second case may occur in case of adult, that is fall on the shoulder. And last one is during prolonged anesthesia. If the shoulder is not supported well, Arps palsy may also be occur. Okay. So if you ask which nerve root are involved in case of Arps paralysis, only tell one nerve root, the answer will be C5. If they ask what are the 2 nerve roots, the answer will be C5 and C6. So let's see what are the nerves and muscle involved. Supraescapular nerve that arise from the upper trunk bearing the nerve root of C5 and C6. So this nerve will be affected. And now what are the muscles supplied by the supraescapular nerve? One is supraspinatus, another is infraspinatus. So these two muscle will be paralyzed. Number 2, axillary nerve also bears the nerve root of C5 and C6. So axillary nerve also will be paralyzed. So as a result, deltoid muscle and teres minor muscle also will be affected. Okay. Next nerve will be affected is musculocutaneous nerve, which bears the nerve root C5, 6, 7. And we know that musculocutaneous nerve supplies three muscles. One is coracobrachialis, second is biceps brachii, and third is brachialis. All these muscles are involved in elbow flexion, and supraspinatus is involved in arm abduction. Infraspinatus and teres minor is involved in lateral rotation of the shoulder. Deltoid is involved in abduction. So these movements will be affected in Ars palsy. And last one, only a part of radial nerve also will be affected in Ars palsy, and in that case the muscle will be involved is the supinator. So what are the movement will be affected? Number 1, deltoid and supraspinatus causes abduction. So abduction will be impaired. Infraspinatus and teres minor causes lateral rotation. So this movement also will be involved. Similarly, biceps brachii and brachialis causes flexion of the forearm. So flexion of the forearm also will be affected, and supination of the forearm. This movement will be affected or not possible in case of Ars palsy. So if the deltoid and supraspinatus is paralyzed, so no abduction will be occur. So the deformity will be adducted arm. Clear? Similarly, infraspinatus and teres minor are paralyzed, so no lateral rotation of the arm will occur. So the deformity will be, arm will be medially rotated. So the deformity of the arm is adducted and medially rotated. Then biceps brachii and brachialis causes flexion of the forearm. So it will be paralyzed. So forearm will be extended. And last one, no supination will occur. So forearm will be pronated. So deformity in the forearm will be extended and pronated. So this is the deformity in the Ars palsy. The arm will be adducted, medially rotated, and forearm will be extended and pronated. These are the deformity I already told you. Besides that, as the deltoid is paralyzed, there will be atrophy of the deltoid, causing deltoid is responsible for the rounded contour of the shoulder. So as it is paralyzed, so rounded contour will be lost. Okay, next, in case of Ars palsy, two jerks will be affected, and for this jerk C5 and C6 nerve roots are involved. One is biceps, another is supinator. Both these jerks will be lost. And last one, what will be the sensory disturbance? Sensory disturbance will occur in the lateral part of the arm, mainly in lower lateral part of the arm or lower lateral part of the deltoid. Some books also told that there is loss of sensation on the lateral side of the forearm also. But uh, in BD Chaurasia, I found only a small loss of sensation on the lower part of the arm only. Okay, this is the picture of Arps palsy. Here the arm is adducted, medially rotated, forearm is extended and pronated. The classical features, and it is in that case it is caused by the birth injury. Okay, here is also the same deformity, and now there is a uh, term used to call this deformity, that is policeman tip deformity or waiter's tip deformity. I don't know why this is called. This is like some when waiter get tips from the customer, is the waiter get the tips like in this deformity? I don't know, but it's like some receiving some bride from someone. Take it. That means, so maybe this is called policeman tip deformity or waiter's tip deformity. Okay. Another injury that is important in brachial plexus, that is clamp case paralysis. In Alps palsy, it occurs in the upper trunk, but in clamp case paralysis, it occurs in the lower trunk. And here, two nerve roots are mainly involved. One is C8 and another is T1. But mostly, if you ask the single nerve root, that will be T1. And another thing, uh, don't confuse with clamp case paralysis with ulnar nerve palsy. These two are not the similar. In clamp case paralysis, mainly nerve roots are involved, and ulnar nerve is a totally different thing. Okay, so what are the causes of clamp case paralysis? When a person is fall from a height, and to prevent falling, if he clutches something to hold the fall or prevent the fall, there is hyperextension of the shoulder, and this mechanism causes injury to the lower trunk. Other different causes may include difficult breast delivery, cervical rib, or abnormal insertion of the anterior and middle scalenus muscle. Okay, all may cause clamp case paralysis. So, what are the nerves and muscles involved? When T1 nerve root is involved, it mainly supplies the intrinsic muscles of the hand, all the intrinsic muscles of the hand, that may include interosseous muscle and lumbricals muscle. Okay, and you know what is the function of lumbricals muscle? In case of clamp case paralysis, you have to know that lumbricals muscles are involved in extension of the finger. This is important. This is important to calculate the deformity or to understanding the deformity. And C8 nerve root supplies two flexor muscles of the forearm. One is flexor carpi ulnaris and another is medial half of flexor digitorum profundus. So, we know that there are 5 superficial flexor and 3 deep flexor present in the forearm. So, two muscles are mainly involved due to involvement of the C8 nerve root. So what is the action of flexor carpi ulnaris? It causes flexion of the wrist, fingers, along with it causes ulnar deviation of the wrist. So if the flexor carpi ulnaris is paralyzed, there will be obviously radial deviation of the wrist. And second is flexor digitorum profundus. We know that digitorum profundus and superficialis. Profundus is responsible for flexion of the wrist along with flexion of the all joints of the hand including finger. So in case of distal interphalangeal joint, the flexion is brought about by flexor digitorum profundus. Okay, so let's see what are the muscle involved and what deformity occurs. We know that we already told that all the intrinsic muscles and including lumbrical muscles are paralyzed. So there will be loss of or weak finger extension. As because there is intact radial nerve, finger extension will not be lost totally really. There will be weak finger extension. And in case of paralysis of the flexor carpi ulnaris and medial half of FDP, there is weak flexion of the wrist as because the other flexor muscles present on the forearm will be supplied by median nerve. So flexion of the wrist will not be lost totally and there is radial deviation of the wrist. Okay. C8 and T1, that means clamp case paralysis, do not involved in any jerk, so no jerk will be lost, but there will be sensory loss. Sensory loss will occur over the ulnar border, that means medial side of the hand and forearm. These are the distribution by C8 and T1. So the sensation loss in this area will occur. Okay. So what is the deformity in clamp case palsy? The deformity, we know that it is called claw hand. And what is defined claw hand? There will be hyperextension at the metacarpophalangeal joints along with flexion of the interphalangeal joints. So this is called claw hand. Metacarpophalangeal joints hyperextension and interphalangeal joints flexion. Okay, this is all about brachial plexus injury. I hope it will be useful for you. If you have any question, feel free to ask in the group or page. Thank you.